Joining us today on Studio 3 is Dr. Chapman from Living Well. Good morning, doctor. We're always excited to talk to you about the latest, the best products here for your face, your skin, your health. So I know we're talking about microneedling and PRP. For those who may not know what those things are, can you explain it to us?
Sure. So microneedling is a process whereby we take very tiny needles that are attached to a device. Our particular device is called WSAZ, and we make circular motions on the skin, which makes little micro ports in the skin to allow for product or for, like you said, PRP, and I'll explain what that is, to penetrate deeper into the skin and into the dermis. And also by creating this, what we call microneedling effect, we get micro damage to the skin, and then the body comes in and heals that by stimulating collagen and hyaluronic acid to form. Some pictures are coming up right now that show some of the things we use microneedling for, one of them being acne and acne scarring, the other one being just uneven skin texture and tone. So if someone has sun damage or if someone has lots of fine lines or wrinkles, this is an excellent treatment. It has little to no downtime. It's on a scale of 1 to 10, patients say it's probably about a 2 to a 3 at most. You leave with a nice little glow that looks like you've had a little bit of a suntan with a little bit of pinkness to it, and then that fades usually over the next 12 hours. PRP, you mentioned, is platelet-rich plasma, and basically what we do is we draw blood from the patient. We spin it down in a separate special centrifuge, which is a device that separates the red blood cells from the serum, and then we use the serum that comes off of that because it's rich in growth factors and lots of nutrients, and we apply that to the face after we've performed the microneedling. When we do this, it really stimulates the dermis to produce healthier epidermal cells, and so the skin just starts to look amazing and very rapidly. We recommend these procedures to be done about every 2 to 3 weeks, and we recommend about 4 to 5 in a row, which will really actually transform the skin.
Is this the same thing as, I know it was in the headlines a while back for Kim Kardashian, she did something called the vampire facial. Is this the same treatment?
So it is the exact same treatment. We just do not have the rights to use the term vampire facial. So that's actually a patented term. Oh, okay. So we call this WSAZ microneedling with PRP.
Okay, and I mean your pictures are incredible. It would be great, very beneficial for someone who's had, you know, a scar that they want to get rid of. I know you mentioned acne scars, but it looks like other scars as well.
Correct. This can be done anywhere on the body, but it's usually done on the face. But if someone has a lot of scarring in other areas, or even stretch marks over the belly area or along the arms, because a lot of people get stretch marks on the insides of their arms as they grow, it can actually be done there as well. And also in combination with other laser treatments that we do for that, it's just phenomenal. The synergistic effect of this with other treatments is amazing as well. But, you know, if someone wants to just really transform their skin and transform it quickly, microneedling and microneedling with PRP can be done in about 20 minutes to 30 minutes is the treatment time, little to no downtime. And like I said, about 3 to 4 treatments in a row will really make a difference in someone's skin.
I know you mentioned 3 to 4 treatments in a row. With the picture we saw there, incredible results. It said after 4 treatments. You know, and you said 2 to 3 weeks really spacing out. Is there too close of a time, too far of a time apart? What's your best recommendation?
Yeah. You want to give the body time to heal itself and get the most out of the stimulation. We actually do our treatments every 4 weeks, but they can be done as close as 3 weeks depending on the response of the patient to healing. But usually it's 3 to 4 weeks apart that these are done. I wouldn't do them any closer because you want to give the body, you're stimulating the body's response to heal itself, so you want to give it time to produce that collagen and elastin before you go back in, and hyaluronic acid before you go back in there and re-stimulate.
Yeah, so that downtime's really important. Are these results permanent?
They're permanent, but we do recommend that you continue to treat because you're going to have continued aging and environmental factors that damage in the sun. So the best thing to do is once you go through a series of about 4 treatments, then you do about 1 every 3 to 4 months, and that really keeps the skin looking nicely. The other thing we will say before we go is that, definitely if you do this procedure, if you don't do it with us, if you do it somewhere else, you definitely need to use sunscreen because you're breaking down the epidermis, so you're definitely going to have a higher sensitivity to the sun.
Sure. Well, Dr. Chapman, thank you so much. Fascinating and interesting treatment there and a really incredible result. So thank you for enlightening us on Studio 3 today.
Thank you for having me.
I was really impressed to see the before and after pictures. And really 4 treatments, like you said, a couple of weeks apart. That's not a long time in terms of, getting such a dramatic improvement. And I've even heard, we were talking about it during the story, that of people who have, even really famous people who've gotten injured on their face, and they use this treatment as a way to correct it. It doesn't seem too horribly invasive.
I just think on the surface you hear microneedling and you hear needle and you automatically, I think just by the name, you think it's going to be something very painful, maybe with a little bit of a recovery process, but it sounds
like what
very
Dr.
simple.
Chapman said, really on like the pain scale, 0 being the lowest, 10 on the highest. He was saying it's only like a 2 or a 3. So, but you hear that word needling, and it's like,
he does a really good job too of actually showing instead of just telling you about the procedure, and it kind of takes the nerves away.
But if you have acne scars, I mean, it really looks like it works, or even just some sort of injury.
Like a good option.
Yeah, a good option. Well, NASA's first